Hello, I'm Scott Percato, and welcome to In Focus. Our guests are Jagdish Khubchandani and Karen Kopera-Frye, professors of public health sciences in New Mexico State University's College of Health, Education, and Social Transformation. They've recently collaborated on a series of studies to understand the long-term impacts of food insecurity among American adults living with colorectal cancer and chronic kidney diseases. Dr. Khubchandani, Dr. Kopera-Frye, thank you for joining us on In Focus.
Thank you for inviting us.
Well, let's start with you, Dr. Khubchandani. What led the two of you to conduct these studies?
We have our healthcare expenses are rising across the nation, much of it because of chronic diseases. People are losing their lives to chronic diseases. We wanted to know what are the other factors that influence life expectancy in people who have chronic diseases, social things that we could do, social factors. And one major problem is chronic diseases are expensive. On top of that, you need to maintain healthy diet and nutrition, and people are not able to maintain that. So we wanted to know what's the impact of food insecurity, poor diet on chronic diseases.
And Dr. Kopera-Frye, why did you decide to zero in on food insecurity's effect on colorectal cancer and chronic kidney diseases specifically?
You know, it is an important issue. 100 million Americans have at least one major chronic disease. So we're thinking about, as my colleague Dr. Jagdish indicated, the healthcare expenses are on the rise. But colorectal cancer, when we looked at premature mortality or dying sooner than would be expected, you think a disease process, a chronic disease such as chronic kidney disease or colorectal cancer. Some startling figures we found in this study. One of them is that there is a fourfold increase with colorectal cancer and food insecurity. Premature death over just having colorectal cancer alone. So it's suggesting the importance of that other factor called food insecurity. With chronic kidney disease in a sample of over 10,000 adults, over 50 plus years of age. Again, a double the increased mortality rate when you add food insecurity to the equation of chronic kidney disease. So I started digging a little deeper. That's off of the National Health and Nutrition Study, which is a CDC, Centers for Disease Control, national study, representative, all regions, geographies, populations. And with this, I started drilled down a little into New Mexico and finding that we are in the top 5 states with Arizona, Mississippi, and Louisiana in food insecurity, highest rates. So a startling figure to me, I looked at in Centers for Disease Control in 2018, over 326,000 New Mexicans suffer from food insecurity. And when you look at the below the SNAP's Supplemental Nutrition Assistance Program, when you look at the poverty threshold, 74% of our adults in New Mexico fall below the poverty for SNAP, which is a federal poverty threshold. So it's more of a salient issue, if you will, here in the borderland region where we have pretty high economic challenges and poverty rates.
And as far as I'm sorry, go ahead.
Yeah, I think that the medical model of prescribing medication and therapy in this case won't help. Unless people are fed well, how would they get out of their chronic disease or be able to maintain the lifestyle that's needed with chronic diseases to maintain healthy diet?
Well, in the different studies, for the colorectal study, you used a sample of more than 30,000 adults
from NHANES,
20 years older across the nation, and for the kidney disease, it was 10,000 adult Americans with the diseases. And how were those studies conducted?
So we used the data from the CDC, the National Health and Nutrition Examination Survey, from 1999 onwards. Then we linked these participants' health data with their mortality file from 2019 through the National Death Index, which is the CDC death files, to see how many of them survived with chronic disease, without chronic disease, with food insecurity, without food insecurity. So we conducted deep analyses on participants from 1999 onwards to see how much they survive by dividing them into various groups.
And Were you surprised at all of what you found in each of the studies? Were you astounded?
Well, yeah, I think I was, with the high rate of death due to food insecurity alone and combined with chronic disease.
Right, right. And you know, if you think about it, it takes a village, right? There's many factors that go into chronic disease, but oftentimes in the medical model, as you alluded to, you know, it's treat the disease, the chronic disease process, and maybe not so much thinking about, does this person have adequate nutrition? You know, how is that going to advance the progression of the disease to increase premature mortality? And so what I was surprised is, and the take-home lesson to me, I suppose, is that interprofessional teams need to wrap around care around the particular patient. So you need a registered dietitian, you need a nephrologist to look at the cancer, right? But there's also a whole team, social workers, everybody, nurses are all part of this interprofessional team to provide them optimal care. How often do doctors ask you for, if you went for with certain symptoms and you went to the office and said, I have these problems, do they ask you about how's your diet? Do you have adequate food? Do you have adequate access to food? The U.S. Department of Agriculture defines food insecurity as not only inaccessibility to nutritious food, but food deserts they talk about, and we are in one of those food deserts. What does that mean? It's cheaper to eat unhealthy, right? You could buy a hamburger, well, not 99 cents anymore at McDonald's, but you know, that is not good for you versus going to the grocery store and spending more money, and this is post-COVID too, it's really been more of a problem, for lettuce or leafy vegetables that you need to help boost your immune system to fight this disease. And so, you know, it's a whole systemic kind of thing. We need to think about other factors and have healthcare professionals really hone in on that.
Yeah, these two disorders that we picked on, I want to mention chronic kidney disease, you need to be having a very balanced diet. You cannot have too much sodium, potassium, protein. Same with colorectal cancer. It's near the stomach. You have to eat right to get into remission phase or have the right treatment outcome.
All right. Professors Jagdish Khubchandani and Karen Kopera-Frye, we thank you for joining us on In Focus.
Thank you for having us again.
And thank you for joining us on for another episode of In Focus. I'm Scott Mercado.